But for me as a patient, if you have a long-term condition, you have a period where you're quite well and you're self-managing right through to perhaps where you need inpatient level care. And for me, this is about how do you use technology to give people health education advice in the very early stages, or to be able to self-monitor and discuss with their practice nurse or GP, right through to models like we've got in Airedale, where it's a digital care hub, where nurses are proactively monitoring what patients are putting into the app, through to if whatever interventions aren't working and I end up needing hospital level care, I can still have that at home using the technology. But the workforce behind the technology might now be acute level clinicians or clinical nurse specialists or whatever. And if I inevitably if I happen to then have to be admitted to hospital and I'm discharged, I can go back using that tech and have those same people caring for me. For me, it's about feeling supported and connected, but having care in the optimum place for you. And that's very often in a person's own home.
Yeah.
From a
tech point of view, it's really simply about having one app that you can use wherever you are in the health system, whether you're in hospital, whether you're seeing your GP, whether you're being looked after the community health provider, all using a single app.
You did also both talk downstairs about the information feedback loop. Can you give me some practical examples of what that does actually mean on a day-to-day basis?
Well, I had this conversation earlier this week with a nurse in one of the trusts who was talking about how they have patients that they're monitoring and they're monitoring their vital signs. And this for me is as much about moving away from a paternalistic model of care where, clinicians are the experts and enabling patients to be experts in their own care. But the nurse said the patient rang up to say to them, oh, by the way, I know my saturation levels have just gone up, but don't worry, I've just been doing something that has, I'm fine. So the patient knew that, I've got an abnormal reading, but actually I'm fine. So it's not just about, people talk about, are we creating the worried well? I would argue we're creating the informed, responsible patient who knows when to connect and is happy to be monitored at home because they feel still connected.
It's interesting. I think people are constantly connected just in their day-to-day lives in everywhere else.
Yes.
Why wouldn't we also be in healthcare?
Yeah.
Well, exactly, and really the term comes from Matthew Syed's book called Black Box Thinking, which is all about how you improve things. And so this is the constant iteration of getting information, feeding back on information. And the joke that I made, which is not really a joke, is imagine you went to hospital, you had an ECG reading, and then they said, okay, we'll give you the result in a month. So essential in medicine is timely and accurate information. And so if that's true in ED, why is it not equally true in every other part of the system? And really what remote monitoring allows you to do is get timely and accurate information about all of the patients you need to look after in real time, and so you can respond appropriately.
So I got the impression that remote monitoring is quite common in some of our neighbouring European countries, but less so in the UK.
Yes.
How do you think events like today can actually help speed up the journey that we probably need to go on ourselves?
And I think I mentioned being at a conference recently, and a cardiac physician said, there are doubters out there, and they're not our patients. And he was basically saying there's still a risk aversion amongst clinicians, and I can understand why. I mean, I'm a nurse by background. I can understand why, but equally, I think we think at a system level, we know, if someone's on a physical ward and they can go home and be monitored and be connected and be really well looked after, that's a known entity, whereas actually the patient's still waiting for an ambulance in their own home that we know nothing about because the ambulance can't even get there because they're queuing up outside ED. That's a big risk. So we need to really think about, at a system level, where does risk lie and where this, I hope I'm answering your question, where things like remote monitoring can add value. I mean, I would argue the word remote is a poor choice of word. Now, I mean, I was involved in the initial stages of this in NHS England, so bear some responsibility, because it actually doesn't make a patient remote. It makes them more connected, I would say, than they've ever felt before.
Yeah. Where do you think the perception problem is? Because is it patient perception or is it clinician perception? And again...
Well, if you look at... Sorry, you need a break. So what's the problem? So if you look at the Health Foundation information from last year, that said 75% of people are pro-remote monitoring. There's plenty of empirical evidence from different parts of the world about the benefits of remote monitoring. Lucy, for example, has done 350 implementations in 11 countries, and as we talked about earlier, something like 80% we provide remote monitoring to 80% of the hospitals in the Netherlands. I think it's really the fear of the unknown, isn't it? And what is familiar and what is not familiar. We know that older people lose 5% of their muscle mass in hospital every day, and yet we prescribe acute care for them, knowing that it harms them. Remote monitoring is at worst neutral and at best hugely transformative, and yet we don't, if you like, prescribe remote monitoring with anything like the same it's nothing like as commonplace. So really this is a typical change cycle, and I think really what the NHS needs to do is it needs to move from individual clinicians who have a passion for remote monitoring to whole systems who embrace it and truly commit themselves to digital care over the long term and persuade all the various stakeholders they need to embrace this.
And I would add that I wouldn't want you to think that there are pockets of fantastic buy-in in the NHS. There is evidence of impact. But I think it comes back to the point I made earlier. So we have an annual funding cycle, so people can do something for a year and then they're not sure if it's going to stay. And we have a history of this in the NHS about pilotitis, it doesn't move on. So I think in 5 years' time we'll look back and think, why were we not really embracing that? Because it'll be the norm of how we deliver care. But unless we have a sustainable funding model, and the money is there, but it's probably still being used for traditional solutions like physical beds, or extra winter surge beds or whatever, rather than thinking how could technology enable us to do something different. And we should acknowledge for clinicians there is a worry that no one has line of sight anymore, because in a ward you've got line of sight. I would argue, particularly with regular monitoring, that you've probably got better line of sight than sometimes in a bed in a side room.
Absolutely. Last two questions. Some of the key things you'd like him to take away from the event today, following your session.
So, firstly I should say I'm a nurse. I got involved with technology-enabled care in sort of EPRs and the London Programme for IT in 2003. I was like a lone nut because I'm a female and I'm a nurse in a very male-dominated environment. Today for me is just fabulous because I think it's the first pure nursing digital event, and nurses aren't just here as a sort of lone voice or a meek voice, they're here as a very loud voice and as policy owners and people of influence. So I'm really excited, so I think I'd like people to go away today thinking I have a loud voice and I'm going to use it.
And yourself?
I think we just need people to try it. In any system, you've got the forces of change and the forces of inertia. And ultimately, the forces of change have to be stronger than the forces of inertia. And that only happens if you have enough people who try it, who produce such a volume of evidence that in the end, even the detractors realise it's the right thing to do.
And last question, what would you say to people to encourage them to come next year to this event?
I think this has been a great event, actually. I ran a nursing-led organisation, and much of change is driven by nurses on the ground. And so it's extremely important that nurses buy into remote technology, because they're the ones who will make it work.